Hello everyone, I'm Shaini, lecturer, Tripoli College of Nursing. Today we will be discussing about anti-anxiety drugs. Anxiety is an emotional state, unpleasant in nature, associated with uneasiness. It's a fear that seems to arise from unknown source. Discomfort and concern are fear about some defined or undefined future threat. Some degree of anxiety is a part of life. Treatment is needed when it is disproportionate to the situation and excessive. Some psychotics and depressed patients also exhibit pathological anxiety. Physical symptoms of severe anxiety are similar to those of fear, such as tachycardia and sweating, trembling, and palpitations. Anxiolytic sedative drugs differ from antipsychotics. Anxiolytics also more closely resemble sedative hypnotics. These anti-anxiety drugs do not produce any extrapyramidal side effects. Anti-anxiety drugs, also called as minor tranquilizers, most of them belongs to the benzodiazepine group of drugs. Physical effects of anxiety disorders: dizziness, decreased sex drive, irritability, increased muscle tension, rapid breathing, breathlessness, heart palpitations, increased blood pressure, nausea or diarrhea, sweating, chest pain. So these are the physical effects of anxiety disorders. And classification. Anti-anxiety drugs classified into three groups: barbiturates, non-barbiturate, non-benzodiazepine anti-anxiety agents, benzodiazepine. So these are the three groups: phenobarbital, pentobarbital, secobarbital, and thiopentone. These medicines comes under barbiturate groups. And ethanol, diphenhydramine, and methaqualone comes under non-barbiturate, non-benzodiazepine anti-anxiety agent. Benzodiazepine again are divided into three groups based on the action. So divided as very short acting, and long acting. Triazolam, midazolam comes under very short acting, and oxyciform, lorazepam, alprazolam comes under short acting, and chlordiazepoxide, diazepam, clonazepam, flurazepam, and nitrazepam comes under long acting medication. So the benzodiazepine are the most widely used anxiolytic drugs. So they have largely replaced barbiturates in the treatment of anxiety because benzodiazepines are safer and more effective medicine. And so indications for benzodiazepines: people those who have anxiety disorder and insomnia, depression, panic disorder, and social phobia, obsessive compulsive disorder, post-traumatic stress disorder, and bipolar on disorder. Other psychiatric indications such as alcohol withdrawal, substance use disorder, and psychotic agitations. So these are the common indications for benzodiazepines. So dosage of anti-anxiety drugs: alprazolam 0.5 to 6 mg, and oxyciform 15 to 120, lorazepam 2 to 6, and diazepam 2 to 10 mg, clonazepam to 0.5 to 20, 2-deoxyphosphate 15 to 100 uh, per oral, and 50 mg to 100. Uh, we can give slow IV, and nitrosifam 5 to 20 mg. So these are the dosage. Mechanism of action: benzodiazepines binds to specific sites on the GABA receptors and increase GABA level. Since gamma aminobutyric acid is an inhibitory neurotransmitter, it has a calming effect on the central nervous system, thus reducing anxiety. Benzodiazepines increases the frequency of channel openings produced by gamma aminobutyric acid. Then we'll be discuss about side effects. These are the common side effects of anti-anxiety drugs: nausea, vomiting, so weakness, blurring of vision, body aches, epigastric pain, diarrhea, impotence, ataxia, dry mouth, retrograde amnesia, impairment of driving skill, dependence, and withdrawal symptoms. So these are the common side effects of anti-anxiety drugs. And nurses' responsibility in the administration of benzodiazepines is administer with food. While administering anti-anxiety drugs, so we can administer this medicine with food. This is for minimize gastric irritation and advise the patient to take a medication as exactly as directed. So the reason is withdrawal may cause insomnia or irritability, sometimes epilepsy too. And we need to explain about as adverse effects and advise the patient to avoid activities so that require alertness. And we need to caution the patient to avoid alcohol or any other CNS depressants along with benzodiazepines. And also we need to instruct the patient not to take any other medicines along with this anti-anxiety drugs. And if IM administration is preferred, we need to give deep IM injection. And for IV administration, we should not mix with any other medicines. We need to give slow IV. Otherwise, what will happen? So sometimes patient may go for a respiratory problem or cardiac arrest. So we need to monitor vital signs while giving medication, especially for IV administrations. So these are the things we should keep up in our mind while administering medications. Hope you got a little information about anti-anxiety drugs. Thank you.